If you work in health or social care, there are some things that you should always remember as basic rules for the delivery of dignified care. They are things that you should always do, and they will improve the experience of the people you're supporting. The first one is simple. Always treat those in your care with respect, dignity, and compassion. Think about how you'd want one of your own family to be treated, and then treat everyone in that way. Smile, be warm and friendly, and of course, be patient. Sometimes this isn't easy, especially if the person you're helping is bad-tempered. But look beyond their behaviour and you may see that they're scared, in pain, or even lonely. By being compassionate and treating them in a dignified way, you'll hopefully start to break down barriers. Next, always remember nutrition and hydration needs. Correct nutrition and hydration will help people stay healthier and more active for longer. Therefore, you must always encourage people to eat and drink. The best way to do this is to provide things that they want. And absolutely never rush anyone. Your patience is key to their well-being. Remember drinks too. Use straws, ice cubes, anything that makes drinking more enjoyable. And if you're supporting someone in their own home, make sure that they drink while you're there and then put a manageable flask or jug close by for when you leave. Always encourage feedback from the people you support and their families and friends to help you understand about the care that you're delivering. This needn't be scary. Often the feedback will be positive, so you'll know you're doing things right. And if the feedback isn't great, then you can think about how you and your service can do things better. Leaving "How did we do" cards around and a box for people to put their confidential answers in may be a good idea, as it can help avoid those awkward conversations where people may not feel comfortable saying what they really feel. Providing opportunities like this can help avoid more formal complaints later on. Always challenge poor practice at the time. This isn't always easy, but it's absolutely vital. If you see someone doing something that concerns you, you need to challenge them there and then. It doesn't have to become a big deal. Often you can do this in a friendly way. You could say, "Gosh Steve, is something up? You're being a little short with Mr. Brown today." Or, "Oops, Marion, I think you've forgotten to wash your hands." Obviously, it's best to make these challenges out of earshot of your clients or patients. It might be a little embarrassing for the people you challenge for a short time, but they're likely to change their behaviour so that the people they're caring for will have a much better experience. Finally, always report abuse or neglect immediately. If you see something really concerning that you don't feel able to challenge at the time, or you've challenged it and you're still really worried, you must report it at the earliest opportunity. Perhaps you witness physical or mental abuse, or you know that someone has given the wrong dose of medication and there's been a cover-up. The implications of things like this are huge, and it's likely that they will be dealt with as safeguarding issues. If you don't act and report it, you could be seen to be colluding with what's happening, and your own role could then be in jeopardy. We know that reporting bad practice like this takes courage, but you have a duty to protect those that you care for. So, to recap, if you follow these always rules, the people you care for are much more likely to have positive experiences, and work should be more rewarding for you too.